All right, let's.
I'm logging in. I'm checking it right now. Did you see any comments that have started coming in?
I don't know if they're old or new. Let's see here. Can you guys hear me? And see me? I think I need to put my face in here because you.
Yeah. You see any comments that have started coming? Doug, you are live. All right.
Okay.
You're live. I can see you. You can go ahead.
Okay.
Okay. You have them coming in. People are commenting and everything, so you're good.
Okay. So why don't you hop off so I could. I don't know if they're old or new. Let's see here. Can you guys hear me? And see me? I think I need to put my face in here because you.
Yeah. You see any comments that have started?
I don't know if they're old or new. Let's see here. Can you guys hear me? And see me? I think I need to put my face in here because you.
Yeah. You see any comments that have started?
I don't know if they're old or new. Let's see here. Can you guys hear me? And see me?
Testing. Okay. I think I got it, guys. I think I figured it out. Okay. How about now? Can you hear me on both? Can you see me and hear me? I just need to know loud and clear. Oh, that's great. Okay. We finally figured it out. We had a little technical difficulties and lost the voice. Oh, did you lose the voice? I'm sorry about all this. Let's see here. Testing. Well, it says that the voice is working. Audio is out of sync. Okay. Let me try one more thing. Testing, default. Microphone. Testing 1, 2. Can you hear me now? You should be able to hear me now. Okay. All right. We're good. Finally. Sorry about that. I know there was a lot of questions that I want to get to. If you have any additional questions, let me know because I am here. Let's see. Okay, here I started this. I assumed everyone was on and listening, and I started answering questions, and had some good answers there. So I'll just pretend like nothing happened here. Let's see here. Okay. Let's see here. Someone asked about the cytokine storm. Okay. The cytokine storm. You want to know about that? Here's what and I'm going to I pulled a question, but I'm going to talk about the cytokine storm real quick. One of the ways that people die from this coronavirus is through what's called a cytokine storm. If you're very critical or severe, it's a hyper-inflammatory condition of the lung tissue and the organs in which you have a lot of damage occurring, and you literally is a high risk of dying. So what happens is that the cell signals your immune cells, killer T cells, and there's like 5 other heavy-duty cells that are involved. And so they come to help, right? And they need a weapon. So their weapon is called perforin, which is a protein that punches holes in the virus. And what happens is that it dumps acid in there and it kills the cells that have the virus in it. So it kills infected cells. But when you have a weakened immune system, or you have some genetic weakness, or you're obese, or you have some pre-existing health problem, that perforin is defective. It's not working. So you imagine this entire immune system coming to battle without the weapon. So what happens is that it never turns off. So you have this situation where you have this cytokine storm where it's out of control because there's no effective way to kill the cell with the virus. So it never dies. So you have this inflammatory condition without a feedback loop, because everything in the body, especially hormone-wise, has a feedback loop. So when the action is done, it turns off. So and we also have a weakness within the part of the immune system that is supposed to suppress and calm down this fire. And so that's really what happens. Well, it just so happens that zinc enhances that process. So as long as you have a strong immune system, you're not rarely going to have that cytokine storm. So you'll actually you might get infected, and then you get better, and everything is resolved. Okay, so Hungry Sammy asked a question. I started metformin for severe insulin intolerance, and it's working like a charm. I'm so grateful that you talked about adrenal fatigue and insulin resistance. Just want to say thanks. Hey, you're welcome. And yeah, metformin out of all the drugs, honestly, has the least side effects, especially if you're taking the B vitamins and the B12, B1 and B12. And by the way, I'm not a medical doctor. I never claimed to be. I'm actually a chiropractor. I don't do that anymore. I actually I emphasize nutrition and wellness. So the reason I'm just giving you my opinion on metformin is because I studied a lot, and out of all the drugs, that one gives the least side effects. And so what will happen is that when you take it, it improves insulin resistance. But the key is really fixing the diet, the real reason why you have this problem in the first place. So that's something you'd want to emphasize. Okay, can MS patients take zinc without hyping up the immune system? Absolutely. They want to take a lot of vitamin D as well. I would take at least 40,000 IUs of vitamin D, and I would take zinc. You don't have to take massive amounts of zinc because you want to take it in a blend of other minerals, but zinc is really good. Probably take maybe 25 or 20 milligrams per day. The thing about zinc is that you don't store it that well. So every time you take it, every time you eat, you're getting your zinc. But if you're not eating foods high in zinc, you are going to be deficient, because 2 billion people on this planet are deficient in zinc. So shellfish, oysters are really high in zinc. Okay, next question is, people with no gallbladder, can they take your products? Yes, they can. There's no contraindications without a gallbladder, just that you may want to take the gallbladder support because it has purified bile salts that I think will help. You take one after a meal. Okay, so let's see here. I'm trying to catch these questions as they're coming through. Hi, I'm from Algeria. You are the best for me. Thank you. All right. Hello, I've heard about blood plasma injections in infected person cured for treat COVID-19. Please, I need your opinion about this. Well, they're doing research right now. The FDA is involved in research right now as we speak that takes the plasma from an infected person who is recovered, and then using that. And I don't know if that test is done yet or not, but it sounds like that makes sense, because once you get this virus, you are going to trigger B cells. B cells make antibodies for pathogens. So your body now has a memory of it. Now it's actually can recognize it and it's ready for it the next time. So they're basically taking the information, like the memory of that, and giving it to people. I think it's a great idea. All right. Okay. Zinc equals biofilm forming, though. Pathogens steal zinc to build homes from. Well, they build more calcium than zinc biofilms. Yes, pathogens eat minerals. They eat iron. Absolutely. But so does your immune system, too. So taking zinc is not going to increase pathogens. You're going to strengthen your own immune system. These pathogens have sneaky strategies of stealing your zinc and making it so you can't get zinc, and making it so you can't get vitamin D. So, but you still need to take it. It won't make things worse. All right. Thought I was going to have an uncle. What? I don't know what that means. Okay, let's see here. Osteoarthritis possible in a case in adult. Yeah, the best thing to do is do intermittent fasting and make sure you're on healthy keto if you have arthritis. Also, you can take stinging nettle root is a really good remedy for that. Okay, Dr. Berg, what can I do to heal acne, red marks? It's been 4 months and the spot's still discolored. There's a product from Standard Process. I don't sell it. You can get it. And what it does is it's called dermatrophin PMG, and you take one before bed, and it allows your skin to heal over a period of time. That's good for scars. People with a stent can stop Plavix after a year. That's a medical question. I have no, I can't give you an answer for that. See, this is the thing I'm trying to solve. There's so many questions coming. It's hard to even stop the flow of questions. How can we normal liver function test? Tell me about silymarin. Yeah, that is a compound in milk thistle, and it's well researched, and it helps to support hepatocytes. So it helps to support abnormal problems with liver function, and I would start taking it, but I would also get your diet in check too. All right, so let's see here. Let's see if I can catch. I have to catch these questions. Okay, hi. Please, can you talk about asthma and inhaled corticosteroids? My asthma is getting worse, but I'm scared of immune suppression and COVID-19. It's a catch-22 because if you take steroids, it does weaken your immune system, and now you're more susceptible. Absolutely. So you may want to try all the natural things for asthma. And the biggest thing is vitamin D. Vitamin D and vitamin C, but mainly vitamin D. High levels of vitamin D is wonderful for asthma. If you can get outside, if there's sun, I would do that. And you also want to do intermittent fasting. That strengthens the lung because it also increases the oxygen exchange and support the adrenals. But you're right, taking steroids weakens your system. Okay, let's see what we got. Hey, I'm a beginner keto animal. Do you think IF keto for beginners is optimal? A 6-hour window? Thank you. Yes. Yes, I highly recommend you start keto, and you combine them. I show you how to do it. Out of all the things that you can do, the healthy keto and intermittent fasting would be the best combination because of the benefits of two things. One is you're generating ketones. And generating ketones has a whole bunch of benefits. And you're also lowering insulin, which has a lot of other benefits. So yes, and 6-hour eating window is perfect. Okay, so someone had a question. Guys, he isn't on yet. It says live an hour ago with no views. Yeah, what we did is I pressed the wrong YouTube channel. Somehow it said the YouTube business channel, so I clicked that, and that's why you couldn't hear me. So right now we are on, and as far as I know, everyone can hear me, but it might be that you can't hear me. So I'm just talking to myself. But I do see questions, so I'm going to keep going. All right, let's see here. All right, so yeah, I don't see patients anymore because I do education full-time. We have different shows. I do different videos. The goal is for me to give you all as much data as I can online, so then you can get the information to heal yourself. All right, so let's see here. Okay, good. So someone said they can hear me, so I think I'm good. All right, I'm going to keep going. Hey, Dr. Berg, I'm from Bangladesh. I've developed low back pain and leg muscle pain after losing 10 kilograms. How can I get rid of this? Well, I would put the curve back on your back. I would get a small piece of foam or roll up a towel and start pushing it underneath the lower part of your back to get that curve in there. You also want to stretch your hamstrings heavily, and that's going to help as well. So you want that curve in your low back. A lot of people have low back pain because they're sitting all day, so you want to keep the curve back, and that's what I would recommend. Also, watch my video on low back pain. You take your hands and you press those at the level of the belly button into your abdomen, and you massage that area. You'll actually relax the back muscles doing that. It works pretty effectively. All right, so I got to get these questions. They're coming so fast. All right, so let's see here. I found one. I found a question, guys. Okay, good. Ex-asthma patient, is he considered at risk for COVID? I think I just answered that. Yes. Yeah. Okay. So there's two types of people that are susceptible to the COVID-19. One are the elderly, and I'm talking about like 60, 70, 80 years old. Okay. They're more susceptible. But if they have a strong immune system, they're good. Also, people with pre-existing health problems. Asthma is one of them. So the reason is because your bandwidth for fighting infections in your immune system is wrapped up in this illness, and it doesn't have the full power of fighting. So you want to focus really on strengthening your immune system. That has to do with diet, has to do with nutrition. I will do a webinar on the immune system, an in-depth what to do if you guys are interested. Okay, you just let me know. All right, so you have some really good questions. I take propolis along with vinegar, an empty stomach. Is that safe? Sure, that's safe. That's totally fine. Let's see here. Okay, so, oh gosh. Let's see if I caught one. I had to literally catch these things because they're coming they're coming by the thousands here. I'm trying to even read it. Okay. Are your supplements safe to take all together? Yes, you just wouldn't necessarily want to take the gallbladder formula with the digest support because they're both different pHs. So you just take those separately, which I explain on the bottle. Okay. Is it safe to be on keto while taking a diuretic blood pressure medication? Yes, it's safe, but you have to realize that taking a diuretic will deplete you of potassium and other electrolytes. And so you want to take electrolytes and potassium, and you may find that your blood pressure comes down from that. But don't mention my name if it does. All right. Are there risks to letting the body recover from bacterial pneumonia without antibiotics if symptoms are mild? No, in fact, it's probably a good thing because antibiotics just weaken your immune system. Will just one Hershey's Kiss candy a day boot me out of ketosis? The answer is yes. Yes, it will. And I just found out from one of my guys that I can control the inflow of with my mouse. Let's see here. Let's see. Oh my goodness. I just found out how to control the questions. I didn't realize it was connected to my mouse. So guess what? This is very exciting. All right. Thanks, Manuel. All right. So I am able to now find the questions, and this has been a mystery solved. Okay, here we go. I can't get my phlegm to cough up. It goes right back down. What happens with... Well, you need to take, like, what is a good remedy for this to actually improve the production of mucus out of your lungs? I would do Spanish black radish. That's a good one. Radishes in general. That's what I would do if I were you. Okay? All right. Here's one. How long does it take to cure a fatty liver? I love it. I have no idea depending on how bad the liver is, but I will say that I think if you do the right thing and you do intermittent fasting and you take choline, I think you can see drastic changes within 3 months. But to fully get your liver back in good shape, it takes like 3 years. So you need to give it some time. I'm just excited about this this new controls. I can actually control these comments now. What do you think about breathing ozone through olive oil combat COVID-19? The thing about ozone, you never want to breathe it through the lungs. You want to take it through different, you can inject it, you can put it through the ears, you can put it through the nose, you can put it on the skin with olive oil, which is great remedy. But as far as it killing off the virus, I don't have any data on that. I don't think it's strong enough, honestly. All right. Okay. I feel difficulty breathing. Is this a symptom of COVID? It's one of the symptoms, but realize this, guys. You have this mortality rate, and they're really talking about this mortality rate being very severe. It's like maybe 1% compared to the flu, which is like 0.1. So they're saying, oh, it's 10 times worse, and they're freaking people out. Well, think about this. Even in America, West Virginia, I don't even think they have any cases, any deaths. I don't even know if they have anyone diagnosed. Why is that? Because of the testing. They don't have enough tests. They don't have, I think they had 180 tests, and some are pending. So the point is that in America, and also a lot of other countries, they have not done a lot of testing yet. It's a small fraction of the population. So if you haven't done the testing, you're not going to get the diagnosis. So the cases that were diagnosed versus the people that are dying, that ratio is going to be incorrect. What you're going to see is a lot more people that really have the COVID-19, but they haven't been diagnosed, which brings down the mortality rates. It brings that ratio down, way, way down. I think that's what you're going to see. That's my guess. But the great majority of people really have mild symptoms from this. So just because you have a little cough or something, you sneeze, or doesn't mean you have it necessarily. So, you know, that's just my opinion on that. Here's my viewpoint, though. The problem is not the virus. The problem is what a bigger problem is what it's going to do to the economy if this thing keeps going. If we go past April or longer, I think the effect on the economy will be very, 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 very severe. And if you take a look at even the Great Depression, the amount of people, the suicides, the amount of jobs lost, the repercussions, the damage that it creates on a worldwide basis, compared to the damage that it's creating now, if you weigh it out, you just need to look relative magnitude of damage. Yes, it is killing people, but it's also killing the people that are elderly, and also they have weak immune systems. So honestly, my opinion as a solution would be to quarantine those people that have weak immune systems mostly, as much as possible, and deal with that. And everyone else, they start strengthening the immune system and get people to work, because what's going to happen is, yes, the solution now of isolating everyone, that's one solution, but is that going to create a bigger problem? I think it is, with the economy. I mean, it's literally bankrupting so many small businesses right now. I don't know if it's going to come back. Not to mention flooding the economy with all this paper money, which is going to be not worth anything down the road. So anyway, that's a big, big problem. All right, so my mother is in stage 5 kidney failure, but is not on dialysis. She is not diabetic, but she does not have low blood pressure or blood sugar, takes vitamin D shots. Her doctor said no to keto. Oh my goodness. Well, you got to realize that the opposite of diabetes, which she doesn't have, the opposite is keto. Ketones are very supportive to the kidney. Of course, if you have a stage 5 kidney dialysis or kidney failure, you can't take certain minerals like potassium. You have to go on a diet that's low in phosphorus, potassium, and certain other minerals. So I would do keto simply because it's going to take the stress off the kidney, and also at the same time make sure you're not taking any nutrients that you're not supposed to be taking. That's simple. That's what I would do. All right. Hey, Dr. Berg, how long does this lockdown, will it continue in countries who are following it? I have no idea, but I don't know. I think it's going to be a situation that hopefully as the weather warms up, things will get better. And I think that I hope the government and different officials will then get people back to work as soon as possible. But I hope they don't wait for every single case to completely get resolved, because by that time, literally, they crash the economy completely. So that's what's happening. The best thing that you guys can do is do whatever you can to keep your stress down, because stress weakens your immune system, and the things that you fear you tend to pull them in. And I think the fear is creating a big damage to the resistance to the situation. So you really want to try as much as you can to do things to not be in fear, and strengthen your health. That's the most important thing right now. Okay, so next question is, how much benfotiamine to take for palpitations? Good point on this, because benfotiamine is a fat-soluble B1 that helps the nervous system, including the nerves that go to the heart. I would take whatever you have the serving size on the bottle. I would take 4 of those per day. Okay. Can I increase my calorie intake as I lose weight on clean keto and continue to lose weight? Yeah, you can do that. Absolutely. Why not? All right. I'm just excited to have this thing work. All right, let's see what we got here. All right, how to cure. I love that. You guys are just putting me in a bind here. I can't cure anything, okay? I'm not curing anything. This is just information to help support your body. Since I remove all the inflammatory foods, well, you need to bring down your carb amount, and you need to start doing intermittent fasting to help your sinuses. And you also need to take foods with vitamin A, especially, and also vitamin D. Okay, next question. Is there any downside to taking 2 to 3 teaspoons of cod liver oil a day instead of eating fish? The serving size is 1 teaspoon. Don't want to be foolish. No, there's no downside. There's no real side effects from that much cod liver oil. Cod liver oil is loaded with 4 things. 1 is vitamin A, 2 is vitamin D, 3 is DHA, which is really important in your retina, your brain, your heart, and also EPA. It's better than fish oil. And 3 tablespoons, I think, is very good as a protective measure for your immune system. All right, let's see here. Will zinc beat the coronavirus? Not just zinc. Zinc is just one factor. You want to, zinc can help the immune system. That can support the immune system, but there's a lot of things you have to do. And I'm going to do a webinar to help you bulletproof yourself if you guys are interested. Monolaurin, that is for corona. Monolaurin is it's a type of factor that's for the immune system that's in coconut oil and breast milk. If you can't get the breast milk, which I'm being very sarcastic, you're not going to get it unless you're a baby, you'd get it from coconut extract. I don't think it's strong enough to actually handle the coronavirus. All right. Let's see here. Dr. Berg, can I use retin A to decrease, should I decrease any oral forms of vitamin A? I would be very careful about taking a synthetic version of vitamin A. If you look on the back of the label, so many vitamin A products are made synthetically, and I'll let you do your own research on that, but the best way to get vitamin A is from a food source or cod liver oil, but not the synthetics. I am very much against that. Someone is asking about the weather and how will the weather affect the coronavirus. It's going to slow it down. There's definitely a relationship between temperature and humidity. It's definitely going to slow it down. Is it going to eliminate? Is the weather going to cure it overnight? No. The weather is one factor. You also have the immune system. And I think, this is just my guess, like in Italy, for example, you have a high level of percentage of the population that smoke, that make weaknesses within the lung. Also, you have a lot of elderly people. And you have, they're very, very social, and they kiss you on the cheek, both sides, the same thing in Spain. So that's probably what happened. It spread because you're in contact. It's interesting because where I'm from, you don't do that very much. You kind of keep your distance. You never kiss someone. It's just so it's a new thing for me when I greet people. Okay, so let's see here. Any tips on seasonal allergies? I follow the carnivore diet. Well, I think your immune system will be really good if you do that. But there's a couple things you can do for seasonal allergies. One of my favorite is stinging nettle root and quercetin. Both of those are good remedies for histamines and supporting a healthy immune system. Apple cider vinegar is also good. Vitamin C on the effect of COVID-19. they're doing right now a lot of studies with great results, injecting high dosages of vitamin C. Stay tuned to get that result. But a lot of vitamin C will destroy the virus. But I personally, I would never recommend the injections. I would recommend just a food-based vitamin C, mainly to support a healthy immune system, not to kill anything off, because vitamin C is, especially if it's with all the complex, is a very powerful antioxidant. Plus, it has a track record of really supporting your immune system and decreasing the duration of infections, decreasing your susceptibility. So it does a lot with both viruses and bacteria. Quail eggs, I think they're great, but they're very small. How do you reduce flatulence? My navel is also okay. Well, thank you very much for that. But you need to increase your acid in your stomach, and that's going to help your gas. The other thing is you want to make sure to avoid things that cause gas, of course, like beans and fruit, things like that. Let's see here. Okay. I am 5'10" male. I dropped down from 90 kilograms to 79 kilograms. Doing keto, still have a lot of fat. I seem to plateau. What can I do to lose the remaining fat? Well, the biggest thing is to drop your carbs down even more and increase your fasting and cut down your dietary fat to about 75 grams per day. Okay, let's see what we got here. What is the best type of potassium and magnesium and calcium to take? I prefer the citrates because you can also help lower kidney stones, because citrates bind with oxalates. How to lower cortisol levels? Well, you're talking about how to lower stress. Stop watching the news. The news is literally, it's just in your face 24/7. I'm telling you, it's just not a lot of good news. And I know this might be hard to believe, but sometimes their predictions are not quite 100%. And sometimes they might exaggerate the situation. And sometimes they might hyper-focus on the negative and not the good news. And you may not believe me, but I'm being very sarcastic. I know you believe me. But yeah, you want to reduce your stress levels. I mean, what I do every day, I get outside and go for a walk for 1 hour every single day. Get out there. Everyone's out there now because they're at home. And just get space. And I try to limit any negativity, and I stay in production, and also try to get enough sleep and avoid sugar. All right, let's see what we got here. All right, what do we got? Dr. Berg from Italy, what can I do if I'm underweight? You want to increase your calories, but just do 2 meals a day, not 1 meal a day. And you want to get your calories up and probably add more fat. So that way you'll be in ketosis, but your body will be burning the dietary fat more than your stored fat. Diabetic type 1, let's see here. I missed that question, darn it. Dr. Berg, how badly does COVID-19 affect people who are overweight, pre-diabetic? Well, it's a factor. It's a pre-existing factor. And I think because the insulin resistance weakens the immune system. So I'm not saying those people are going to have a problem, but it's just one factor. If you are predisposed to a virus, the best thing to do is to avoid the virus. Why? Because preventative is easy, and they'll strengthen your immune system and lose weight. I mean, that's what I would do. You don't want to go to battle with an enemy if you're at some disadvantage. What is the advantage the virus has over people? It can attack the weak. What is its disadvantage? It has a hard time killing the healthy people. So why not just focus on getting super healthy, and that way you're going to bulletproof your immune system. Tip for yeast infections: the absolute best thing to do if you have a yeast infection is to cut out all sugars and starve, because yeast live on sugar. What is the relationship between ACE2 inhibitor and COVID-19 virus, and are hypertensive patients more at risk for? No, they're not more at risk, but the receptor in the cell for this virus is an ACE2 inhibitor, ACE2 receptor, I'm sorry. And so what happens is that the viruses hack into that and they go right into the cell. So just because you're on a medication, an ACE inhibitor or ACE2 inhibitor, doesn't mean you're going to have the virus or get the virus more than anyone else. Dr. Berg, what's the quantity of lemon or orange juice to take to improve immunity against COVID-19? Well, I would not do orange juice. That's going to weaken your immune system. Lemon is fine, and I don't think that's going to be enough to support your immune system. You're going to have to do the whole package, which I will do a video on that. Okay, vitamin C and zinc is the best for your immune system. I agree 100%, especially if you add vitamin D. Anyway, I'm going to actually do these talks every single day at different times. So stay tuned for more, and we'll keep answering your questions. I'm also going to, a little bit later, I'll be on Facebook, so if you want to check me out there, you can check it out. Thanks for your questions, guys. Listen, the main thing, the main message of today is to go outside, get outside, long walks, get space, keep your stress low, don't watch the news, and realize that the most important thing, even more than nutrition, is to stay out of fear. Fear. Now, you want to basically keep a very relaxed, stress-free attitude despite what's happening as much as possible, because when you're in that band of stress, anxiety, worry, it's not good for your immune system at all. In fact, it's probably worse than having a nutritional deficiency. It's a very superior or senior thing